Namaskar. We're discussing about a topic which came to my mind, that what an MBBS curriculum is for us with respect to exams. Do exams are the only fate-forming features for us in the MBBS? So I just thought of it along and then decided, okay, I must discuss with you something about this. Now I've been very much extrovert, as you all know, and since the lockdown it has become very much a big test for me to be in the house quarantined since 2 months and then not talking to anyone outside, not going there. And it's very much, I can understand the same is with you guys as well. But then what can be done? Now this technology has blessed us with such a beautiful feature that we can be live to each other, not just 1 or 2 people, but dozens of people together. And if you talk about Zoom or if you talk about other apps, go to webinar, go to meet, this and that, they have facilitated such a beautiful Divya Drishti, what you can call from the Mahabharata, that we are all able to see each other live, experience as if we are sitting next to each other. And this is a wonderful phenomenon of the technology which it has given us. But getting driven with this technology, the question is, as a medical student, are we updating ourselves with the same? Most of the classes, the online lecture series and all of them have started with this online and Prep Ladder, Marrow and all these dams, even they all started with this. But the question is, are we limited to exams? And why did this rise in my mind is that, so sitting at home getting bored, I called up so many friends, more than half a century friends, in a week or 2. And then what I came to know, or even if you chat on the WhatsApp, the common feature which got concluded was that all of them are saying, and they are with the question whether the exams are going to happen or not. Whether the exams are going to happen or not. Are we expected to study for the exams? Is the college going to declare the syllabus, or is it going to take, or some of them, literally they raised a question that is the MBBS going to prolong from 5.5 to 6.5 or 7.5? So I was like, because already it's a long course, 5.5 journey is not small. In 5.5 years, other people from other fraternities and walks of life, they become millionaires, they go to other countries, they go abroad and enjoy their life within 5.5 years of their career. But then we are still in this slow process of learning, because it's a vast subject. So being known to this fact, knowing this fact that it's a vast subject, are we really giving justice to it? I mean, I'm not going to make that boredom routine lecture, oh come on, let us study and this and that. The basic question is, are we understanding the basis of it? Simple. We'll just discuss. If you find it truthful, relevant, you can go on, hearing to me. And if it is okay, you can go with it. I mean, you are free to choose, simply. Because we are free to choose, not free from the consequences of our choice, as I always say. So, the choice is ours, right? Now, coming to the discussion of the same. Okay. So, if we are in first year, okay, we'll go step by step. If we are in first year, we will be talking, okay, anatomy, physiology. Now, the college has completed thorax, partially the abdomen and pelvis. And now we are going to discuss about HNF and neuroanatomy. They are the most complex subjects. Okay, physiology, CVS is half done, RS is half done, GID is left, reproductive system is left, endocrinology is left. If you go to biochemistry, most of the metabolisms which happen, the syllabus is covered in the 2nd term or the 3rd term. This all left. So we are in a big question mark and we are studying for all the IMPs. Now there are 2 sets of people. One who are going to say, oh, we are going to just see the IMPs. We are bothered about scoring good in the marks, good marks in the exam, and just get off this first year and go into the second. There are a few, okay, I don't want to be IMP oriented because I want knowledge. But the question is, when do I start? How do I start? And all this. And because there is no such kind of environment at home that we keep on studying. So then it's become, very much a fantasy-like situation whether we are really going to study from the scratch for those who want to really study the whole thing. And is it practically possible to go through the complete textbook? Most of us are without textbooks. So these are all such questions raised. Okay, now coming to the second year. Okay, coming to the first, I'll state the problems and then how I have tried to attempt to link those problems and jump down to a conclusion I will discuss. So if we are in second year, the pathology, damn vast it is. The pharmacology, no one is bothered to learn the names because it's a one-time scene before the examination for most of us. Very few go through the, they jot down the points, they jot down the classifications, and rectify them and then go one by one every time for a revision and then go for it. And forensic medicine is okay. For those who like it, the CID wala scene is, and the rest are just, away from the subject. And microbiology, most of them don't like it because it's all about microorganisms. But now we are left with no option in the pandemic of COVID-19. It's all about, it's all about the microbe, the virus, that is SARS coronavirus 2002. Okay, SARS coronavirus 2. So now this is about the second year wala scene. Okay, and according to the old curriculum, second year is of 2.5 years. So we all want to enjoy. This is the summer vacation season for the second year. This is the most honeymoon period, and we lost the gathering period also in the month of March. So, and right now we don't have any exams, so we are all in the mood of fun and enjoyment. And if we come to third minor, ophthalmology and ENT, they are small subjects, but PSM is a vast subject, and it's all about the national programs, healthcare centers, this and that. More of sort in the the management system, but it covers a lots of medicine also, prophylaxis, that, prevention, clinical features, and all this. But there is a more of sort expectation of that management wala part, this program, that program. So this is about the third year feature. And in third minor, most of them are with like, oh, we have to go for the entrance exam. So those who are early starters, they go, they start with it, that they have to start for medicine, OBGY, gynecology or obstetrics, pediatrics or surgery or likewise. So they start with the major subjects. And of course, major, I feel very much sad because this is the time that we are supposed to get most exposed to clinics, because everything is practical. May it be medicine, may it be pediatrics, may it be OBGY, or may it be surgery. It's damn clinical, and until and unless we see the patient, it's very hard to go with it. Now this is the scene, importance for each and every year. If you see, the range of importance increases like this. From first year, second year, third minor and third major. There is no concept of fourth year in MBBS. Now, if the trajectory is rising, so the ones who are in first year, second year, third minor are less, with the temperament, okay, we have to study, we have to study, we have to study. And we are all getting exam oriented in this exhausted situation of COVID-19. Now, because we are relating our studies only to exams, this is the scene created by us, for us. It's an imagery for the same sense. But if we just think that, are we restricted to exams only? Is it that? Of course not. If we think a bit gravely, a bit seriously, keeping all our memes aside, keeping all the fun aside for some time, for a few moments, okay, take into consideration. So we are the people who are going to deal with lives. I'm not going to tell you the theory, oh, doctors are God and this and that. We are the people who are going to deal with lives. Life of the patient hangs on the words of the doctor. And this all comes with practice. Okay, what is the problem? This is the problem. That is the problem. Defining the problem is not a great deed. This anyone can do. This we are doing by sitting at home, blaming all types of organizations, governments, this and that, businessmen, economies, and the whole politics. Stating a problem is not a big deal. Finding a solution to it at your level, at our level, at my level, this is more important. At the indigenous level, this is more important. Okay, I don't know what meaning did all of you take when the Prime Minister said we have to become self-independent, self-reliant, indigenous, make in India and this and that. Make in India is a concept. It is not restricted to only industrialization as per me. Okay. We don't have to restrict it just to industrialization. If we tend to remember clearer facts, we will come to know that some years, some decades down the line, India used to import food grains. Now today we are the exporters of food grains. This is about agriculture. Same is about technology. Okay. Now you can see, the ISRO is the best example. So as I was saying that it's ISRO, for example, if it is indigenous. Similarly, at our level as medical students, what can be, what can be indigenous? Now, if I would like to drag your attention to a topic like, say, if it is tuberculosis, if it is malaria, if it is dengue, these are not Western diseases, and I'm not the first one to state them. You can check down the facts. But these are not Western diseases, so it has taken more than 30 years for a malarial vaccine to come into market, that to develop from Africa. Not India, not any South Asian or Asian country. So this is the thing. How can we rely on everything how can we rely for everything on the Western countries or on Chinese products or like that? So same thing is applicable in medical field also. Now once it comes to research, you and me start thinking about laboratories getting this and that and coronavirus. This is the drug, this is the COVID-19 sample. You put it, oh, this is negative, this is positive, this is sensitive, this is resistant. This is not how it works. Lot of research, lot in a research is all about literature, about how much has been studied, who has studied what, and then on the basis of that you build the foundation. So this is a lot of literature work. Websites, sites are known to you. To go on them, to search on them, it's up to us. So what do I do research? How do I do research? Why do I do research? These questions are not relevant here. Just sitting and blaming, no, this government should have done this way, the state government should have done this way, the national government should have done this way, the WHO should have done this way, the UN has not taken the correct stand, and this and that, whatnot. This we can do very simply sitting there, but we are wasting our time. What the hell are we doing? This is the question we must ask. Each one of us must ask to our own self. So, at our level, I'll be working. We're just sitting and criticizing, taking the politics. As I said in the last video, that we are unnecessarily giving a lot of importance to all these things. For development of a country, all this is not required. This is all nonsense. Let the people whose news is happening on this, let it happen. We are supposed to do what we can contribute, what we as an individual can do at our level, in whatever profession we are. We must try to do Make in India for the same. If it is surgical masks, how can we prepare masks? If already how to prepare a cloth mask is known to us, why have we to go and buy surgical mask, this mask, that mask? Why have we to order from China? There's no need of the products. So simply it's no for China and it's indigenous. So this is how we have to conclude to our problems. Now coming back to our discussion of our curriculum. Okay, imagine to the scene that, so Make in India, coming to that also, Make in India, the ultimate aim of a medico is to treat the patients. It's about treating the patients. Now, we cannot restrict our knowledge, our curriculum to just passing the exams. It's not like 1 year is over, you're celebrating birthdays, the second year is over, you're celebrating birthdays. It's not just passing birthdays and getting older in age only. It's about the mental strength, what we develop, the knowledge, what we developed over a course of 5.5 years. It should be in a positive direction, growing trajectory. But we're not doing it. Now it's okay, 2 months we enjoyed, now still we have time. It's a viral infestation, there are viral manifestations, air droplet infection spread is happening rampantly. So it is not going to finish in a month or two. It will at least take a year or two. And this has been, researched from many places. So we have to get accustomed to this situation, adjusted to this situation, learn online, do things online, sit at home, open PDFs and read them. This is how things are going to work. Oh, we cannot see the screen for hours together when we are reading. How can we see the screen for hours together when we are chatting? This is the basic question. We must decide our priorities now. So now, one more thing was, we are restricting it to exams, coming back to the topic again. So think that you are a family of 8 people or 5 people, someone elderly suffered from a heart attack, that is myocardial infarction, and you are not able to give the CPR, that is cardiopulmonary resuscitation, which is taught in different workshops since the first year. And now it was included in the first year, orientation month of the first year students as per new curriculum of MCI. So isn't it a shameful thing? Can we see a patient dying in front of us? Is it worth being a medical student? Learning CPR is no big deal. You go on the internet, search for CPR, you will get n number of guidelines. How can that urge of learning to save lives die? As I already stated, life of a person, life of a patient hangs on your words. For that, those words need to be powerful. They will gain this power only by your knowledge which is verified, your knowledge which is perfect, your knowledge which is absolute true. And this is going to happen only by reading. Unless and until we don't get to books, don't get to the matter, don't get to the facts, it's not going to happen. Always I used to give an example when we talk about vertical orientation of subjects in medical, in MBBS especially. For example, I used to give an example of tuberculosis. If we know the normal anatomy, normal histology of lungs, then we can know how the pathological scene will be in the lungs when a tuberculosis cavity develops. Then only we will be able to, if we know about the pharmacology, which drugs we are going to use, then only we can prescribe medicine, and this only can be practiced in the subject of medicine. If there occurs a tuberculosis in a pregnancy, how it is going to happen, how it is going to manifest, this will happen only we know the obstetrics and gynecology of the patient. So this is, and if we know about the tuberculous bacilli, then only we can think about, if we know the microbiology, then only we can think about the fate of the infection, the prognosis of the patient and all not, and what not. So this example I used to give. Now just one more simple example. Why we are to learn thorax, anatomy, physiology. Now if you see the report, radiological report, which is a final year subject, you can say allied subject to medicine. So if you see the radiological report, they do the echocardiography. What is echo? We should know it's a type of ultrasound. And when we know the ultrasound, at that time we start reading ejection fraction is 30%, ejection fraction is decreased and it is raised, and JVP is raised. When you see the clinical examination, JVP is raised in cases of some, when it is a atrial failure of the thing, and all different types. This is all medicine. We will understand this. We will understand JVP graph. We will understand what is ejection fraction. When we learn this in the first year, the cardiac cycle, which is an important IMP LAQ. It is not an IMP LAQ because it is asked frequently just in the university, because it has a lot of relevance, a lot of importance, a lot of application when you go to medicine. If I don't know what is the ejection fraction in the normal, cardiac cycle, how do I make a difference between what is abnormal and what is normal when a myocardial infarction patient comes to me? When a left ventricular failure patient comes to me, how do I understand whether there is a hypertrophy of the left ventricle or not if I don't know the pathology, if I don't know the background physiology of it, that why is the hypertrophy happening, hypertrophy, atrophy, all this we learned in the first chapter of pathology, and why it's a type of adjustment that the body does or the tissue does in adverse conditions, which is again reversible and irreversible, which forms the first basis of the complete pathology chapter. We will know only when we know the normal. Na? If the left side of left ventricle has gone into failure, left atrial blood will not go into the ventricle, because the blood is not getting carried to the aorta. So if the left atrium blood is not getting into the ventricle, it's getting accumulated there, and lots of back pressure in the pulmonary trunk, and this is nothing but pulmonary hypertension, and this pulmonary hypertension over time will lead to pulmonary edema. This can be acute, this can be chronic. If you put the patient on diuretics, the patient will resolve. Conservative management is done, but there has to be some permanent management to be done. There has to be some surgery done. So all this comes into surgery. Now if you don't know the normal anatomy, if you don't know where is the sinus, where is the AV sinus, where is the SA node and this and that, how are we going to operate on the patient? It's a chain reaction. We learn beyond exams. This is the message, most important message I want to highlight to you, my dear friends. We learn beyond exams because it's a question of life and death when it comes to a patient. I repeat again for the third time that patient's life hangs on the hangs on the words of the doctor. Patient's life hangs on the words of the doctor. So it is utter important that we learn beyond exams. I am not in the state of learning, I am not in the mood of learning, and that I will learn it in the final year in the internship. If this was the case, then never the people who made the curriculum would have elongated it for 5.5 years. Because it's a vast subject. If you go and open Guyton, if you go and open Gannon, if you go and open Harrison, they have used the most minimum size of font they could use, and they have made it into volumes. Just specialities like GI surgeries, which have a lot of scope, on those volumes are written. Duodenum, this much big volume for surgery. This is the scene. Pancreas, this much. So there have been volumes written, my dear friends. So it's a vast subject. It's not like we are going to study during the exam, 1 week previous the exam, 1 night previous the exam. These things don't work. We are learning beyond exams, as I said. So it's up to you. You need to decide whether you want to become a good clinician or you just want to pass through on the paper for exams. And then of course the patient's life will not hang on your words, because your knowledge is not perfect. It's not to the point. It's not utter. It's not absolute. It's not true, and it's not the the only conclusion for the patient situation. So it is up to us to optimize our level of treatment by optimizing our level of knowledge, by optimizing our time duration of study. Quality time and quantity time, both are important. So it's up to us, my dear friends. And that is why I again appeal all of you, I request all of you, it's already 2 months past, we have just enjoyed like anything. Now we need to get directed to our curriculum in this sense for having a better fate. Because even if the syllabus is declared, even if it is declared, even if you are not exposed to clinics, everything is there on YouTube. You can just go, a single word, even if you don't understand, you go. There are different academies, different YouTube channels which have helped. If not, then you can discuss. But everything is available. We are the lucky people of this 21st century. That technology is in our hands. Everything is at a single click. And we must make optimal use of this to optimize our knowledge for a better solution to the patient. And this is how I would like to just go for you with a 3-4 points of brief summary. What we discussed is we are going to make in India, in our field, in our fraternity, in our subject, as per our level, at our level at home. By developing our knowledge, scanning and scrolling through Google and different journals and e-books and PDFs, and concluding to the grave most situations, to the remote most situations, for a better India, for a better healthy India rather. Second, we are learning beyond exams. Third, we have to integrate everything. If we want to learn the final year subjects better, we need to be firm, be accurate, and be complete with the previous year subjects. Everything can't be done in the final year as told to you. And the final thing, we have to be staying safe. We have to aware the people, because prevention is not the, because curing the patient, curing the disease is not the only, the duty of the doctor. Preventing the disease is an equivalent responsibility of ours. So these are a few points which I wanted to bring under your notice, and I hope you will go through them and you will satisfy yourself you will give justice to yourself and justice to the nation overall. Thank you.